So why does it seem like more and more people are getting inflammatory bowel disease or Crohn's disease? From my perspective, is it really probably to some degree has to do with obviously multiple factors, but for me, it has to do with the fact that most people's GI tracts are imbalanced. What I mean by that is there's a concept called the gut biome, and basically what that means is there's the composition of good bacteria and the composition of bad bacteria, and you really want a nice balancing act in regards to that. You don't want too much good, you don't want too much bad, you want a mixture of both. And for most people, unfortunately, with the nature of the food we eat, the amount of antibiotics we take, the environment, the glyphosate and all those types of things all impact the type of bacteria that's in your gut. And when that happens, if you have a prevalence of too many of the bad bacteria, it can affect how your body actually not just digests food, but also how your body protects your intestinal gut lining, because your intestine is really primary source of portal of entry for many disease process, many bacteria, a lot of yeast and fungus and all those types of things. And so if you can't protect your gut, you tend to be exposed to those types of issues. But at the same time, at the gut level, it tends to cause a lot of inflammation, and too much inflammation can give rise ultimately to not just cancers, but also to an inflammatory bowel type symptoms or irritable bowel type symptoms, or even Crohn's disease. Now, addressing those types of issues and maintaining a nice, what they call gut biome mixture, you can help to mitigate the amount of inflammation that your intestinal lining actually exposed to, and that may actually help your Crohn's symptoms. That's why most medications that are geared towards Crohn's disease or inflammatory bowel disease are all anti-inflammatory medications that reside in and around the gut lining, and also immunosuppressant type issues to try to mitigate the amount of inflammation that, again, is generated by the inflammation within the gut.